The Hydration Foundation welcomes Dr. Christiane Northrup, MD. May I say the Doctor of Joy?
Yes.
You are renowned for your championship of women's health and women's unique life cycle. That would be so probably women's health, about 50% of the people on the planet, 50% women.
Yes.
Very important segment. And then, of course, all the boys that are born of women who have babies. So that's the other 50%. So 100%. Yeah, Chris.
That's right. That's right. Yes.
Thank you. And that's come through many subjects, many books you've written, including the groundbreaking book, Women's Bodies, Women's Wisdom. Amazing book. And it's accompanied us as women all the way through. And you've actually been modeling this all along. So we are so pleased to have you speak on your expertise about women's health. But especially we're going to get into the conversation around fashion, because that's something we share and we love. But before we do that, I would wonder if you'd give us a kind of an overview of women's bodies in their life cycle, which of course you documented how it changes, and how you think hydration is primary to each of those cycles.
We are born, we are gestated in fluid, in amniotic fluid, which is very similar to seawater and very similar to the plasma in our veins. And since we are 70% water, at least, we don't function optimally unless we are hydrated properly. And this is very interesting. The lungs of a newborn baby are erectile tissue, just as the lungs are of an adult. And when a premature baby is born, one of the ways that you help it along is you have it breathing nitric oxide, which is produced by the endothelial lining of every blood vessel in the body, and it increases circulation. But it can't do it if you don't have enough fluid around. So I think a lot about the hydraulics of the body. I learned about nitric oxide since it is the pathway through which Cialis and Viagra work, and that's interesting to me. It's a pathway that increases the blood flow to the penis. But lungs are also erectile tissue, and the female erotic anatomy, which is all internal, is also erectile tissue. And it's interesting to me that the spark of life, the place from which we all came, actually requires optimal hydration. And so what you find, it's interesting, as women begin to go through menopause, the change of life, they speak of becoming drier, like I'm getting dry, my skin's dry, my vagina's dry, everything is dry. And it may be that what you must do, you're given, as it were, a quota of easy hydration. And then at midlife, just when your physical fertility for having a baby decreases, your wisdom fertility, your spiritual fertility increases. And you have to pay attention to the physical world so that you stay in the body longer when you are a wisdom container, and not just a baby machine or someone who makes the meals for the family or any of that. So you must consciously do hydration from midlife on to keep everything working. And we're never taught that, ever. What we're taught instead is, here's what the culture does. Oh yeah, well, that's just because of your age. That's what doctors are taught. That's happening because of your age. And that is not true. It's happening because of a number of factors, like your vitamin D isn't optimal and your blood sugar is higher than it should be and all the rest of it. And and salt has been vilified. You're probably low in minerals. And that catches up with you by about midlife. You know, it's like you can get away with, it's like the women who diet, that was me, to get into the little black dress, and you can do it in a week when you're in your 20s and your 30s. In your 40s, the body goes, really? Because that's not going to happen. You've been doing that to me too often. The body says, no, we're done.
Yeah. Well, I'm loving and laughing with you. I love the title of your book, Goddesses Never Age.
Yeah.
So you're speaking, and will you speak a little bit more broadly about what hydration has to do with aging? This is a really broad question. But it's an extremely important question. And one form of asking it is, of course, does dehydration accelerate aging? But another way to ask, and perhaps much more interesting and important way to ask about this, is how can hydration change aging?
Well, my feeling is that anything that keeps a cell vibrantly hydrated and gives you turgor in your collagen, in your skin, all of that is going to delay and postpone what we call aging. Or as Dr. Mario Martinez says, getting older is inevitable. Aging is optional. So there's all these things that you can do. But now this is funny, because I have a friend named Sandra Chu, who's an acupuncturist in Brooklyn. And I gave her a copy of Quench. It has transformed her entire practice. Now what she does, everyone who comes in, she makes them take a screenshot of the book and then buy the book and then do your hydration program, because she said, here's what she's finding. And so her practice is upscale 30, 40, 50 something men and women in New York City, in Brooklyn, which is the cool place to be.
Right.
And she said, all they have to do, if they follow the hydration rules in your book, she said, it changes everything. It changes headaches. It changes weight control. It changes sleep, appetite, relaxation, everything. And then she took it one step further, which I am loving. So she said, get a hygrometer, and which I did on Amazon, and skin functions optimally, the whole body functions optimally between 30 and 60% humidity. So it's winter in Maine where I am right now. So I got one of these things and then I put it in my bedroom. Now I always had a wonderful humidifier system going in the music room for the piano and the harps that I have. Okay, because they needed 40%. Good. Well, then after talking with Sandra, I realized, wait a minute, I'm treating my harps better than my own body. My bedroom, my bedroom was 21%. So I began to put a humidifier in there and began to notice when it's between 40 and 60, again, sleep is better. You don't wake up with a dry throat, any of that thing. But the other thing that that you find when you're optimally hydrated, so people, for instance, when they travel, right, they'll often talk about being constipated, the stress. Think about this. What does stress do? Causes vasoconstriction. Whether it's your bowel going, this doesn't feel safe, or your blood vessels, this doesn't feel safe, or the cervix of the uterus is also a sphincter. The reason women get into trouble in labor is it doesn't feel safe. But when you're optimally hydrated, it's much harder for the sphincters and for the blood vessels to do this stricture thing. One of the things you taught me that has been life-changing is, the tablespoon of chia seeds and a pinch of Himalayan sea salt. And so what I've been doing with that, and I just got back from a trip to Thailand, Mexico, and Laos, and took the chia seeds every step of the way, and it makes an enormous difference. And when I didn't do it, things were much more difficult. And that little pinch of Himalayan sea salt in water, right now I have a little tiny bit of green iced tea, but it's a pinch of Himalayan sea salt in there. I already did my chia seeds earlier. But it's made me begin to look at how nature hydrates. And when you put the chia seeds in water and you let them expand, they look like frog's eggs. Well, of course, all of nature repeats the same pattern over and over and over, like ways to conserve fluid. Life begins in water. It requires water to continue and to flourish. I've noticed the plants in my bedroom now with the humidity higher are blossoming, and they weren't before. So hydration is it's absolutely fundamental. And I don't believe that we have understood it at all until very recently, and especially with the work of the Hydration Foundation, because everyone has just told us, drink more water. And I always wondered, why don't I do this? I know I should do this. Why don't I do this? And what I tell people now is drinking 8 glasses of water is just like peeing on a rock. It doesn't really absorb. It doesn't do anything except make you go to the bathroom more and more. You need to get that water into the intercellular space, into the interstitial space, where it's going to help your secondary nervous system, which is the fascia. Also, Hope Matthews, my Pilates teacher, has a saying, it's not your age, it's your fascia. Because if the fascia is hydrated, then you just don't have the aches and pains and the dryness. And a lot of what we call aging is accumulated dense fascia, essentially scar tissue. And there are ways to work with it. But you have to work with it. First, optimally hydrate yourself. Second, you have to break up the accumulated dense fascia. And you can do it through yoga, and you can do it through massage and acupuncture. See, the acupuncture meridians run through the fascial sheath. So they are a secondary nervous system. And as you know, an electrical impulse at the bottom of your feet reaches your entire fascial sheath instantaneously because it's an electrical system. And it's been ignored by the medical profession. It's interesting, and when I did surgery, I would notice, now I would know what to call it, but in the past, let's say you're doing a C-section and we would call it taco tissue, meaning that someone's diet was just such junky food that the collagen in the fascia was just very poor quality. You almost could dissect, you'd make the opening incision, and then you could dissect right down to the fascial sheath with your fingers because there was no fascia running through the subcutaneous fat that had any quality at all. But we notice when the diet changes and when you're optimally hydrated, then everything changes and the tissue becomes not edematous, not crappy tissue. It just becomes moist, hydrated, healthy. Yeah.
I think even if we could just explain to people, look at your skin. And, that's your most outer fascial tissue. The rest is the same on the inside. If it's starting to get dried and wrinkled and abused, that's an indicator. Use your own self as your diagnostic capacity. Are you fluid in movement? Do you find you get out of bed without your joints hurting you? Do you have joy in your life?
Yeah, that is really, really true. And it's interesting that there's several ways to hydrate. Obviously, everyone should be hydrating internally, and then you hydrate externally. One of the things Sandra has people do is just, spray some kind of hydrating fluid on their skin and press it in the morning or as you go through your day. You don't have to do that if you're in a tropical climate, but you certainly do if you're in the northern latitudes in the winter in particular. Yeah.
We try to offer as many tricks as we can at the Hydration Foundation. So I'm going to take that trick from
Sandra. Yeah, definitely. It's a wonderful trick. Sandra Chu, CHIU, and her business is called Treatment by Lanshin, LANSHIN. Lanshin is her Chinese name. She's fluent in Chinese and an acupuncturist in Brooklyn, and just a wonderful person who specializes in the traditional Chinese medicine approach to skin care and skin health. And what she said is, if you just do the hydration as you have put it forth in Quench, and then you do the extra stuff with the humidity and then, putting the fluid on your face, it makes, she said many times, That's all someone has to do to get rid of adult acne or rosacea or eczema. Yeah.
We would love to put that trick on our website and make sure she gets credit for
Wonderful.
Forward. It's so much fun to collect people and their tips and their ideas. Everybody does it a little differently.
Yeah.
But it's just a joy to bring together a community around hydration and help us exchange how important it is. I would love to hear how you got so interested in fascia. What's your story there?
My story there was that I went to visit Bob Cooley in Boston because I got an email from one of his trainers who had just graduated from Dartmouth. And he said, we're doing interesting things with fascia. And I knew that fascia was important. I knew from the work of Helen, was at the University of Vermont, and I can't remember.
Yes, she did the original testing of the...
Yeah, that's it. And I knew about her work. And I knew that she showed how acupuncture changed the cells and changed the fascia and worked in these meridians.
Right.
So I always had been interested in that. And so when I heard about this iteration, I thought, I am fascinated by that. So I went down and I did many sessions of assisted stretching where you would, and what Bob points out is to change the dense fascia requires an enormous amount of force, which you cannot do with external pressure. Like it would hurt too much with Rolfing. And I've had many, many Rolfing treatments and many other things. But to really get at the dense fascia, you need to use your own muscles or have people assist you with the muscles. And what he points out is that the dense fascia within a muscle will prevent it from shortening all the way. And once you rip out the dense fascia, or however you're going to do it, who's the guy who's done the myofascial release? Wonderful guy. He teaches
Tom
it.
Myers? Tom Myers?
No, it's not Tom. Tom does great work. I think he's here in Maine. Myofascial, whatever. I'll think of his name. But anyway, he says fascia is a semi-solid tissue. However, when it gets really dense and dry, it's not. And you got to get it hydrated to work it. And so Bob did all kinds of work on my pectoral muscles. He said when I went there, let's see if I can demonstrate this. He said to me, your shoulders, the pecs were shortened here. So we had to expand the pecs. But he said, this is because you feel unlovable. So it's been protecting the heart. And there was truth in that. And then my back was like a turtle shell, again, because the heart goes into the back. And I've been kind of a medical outlier because of what I know to be true, but I'm also a very sensitive soul, and it's been a little difficult to be a pioneer that's kind of so far ahead of where the culture has been. It's kind of coming around now, but not as fast as I'd like to see it. So I had like dense fascia in my whole back, like the carapace of a turtle. And then Bob told me that the thymus meridian, which is the sort of the back of the neck, and it's why women get this dowager hump thing.
Yes, exactly.
He said that is all from that's healing. He said, you're a healer, but you've taken on other people's stuff. So he taught me a type of thymus roll down where you literally iron out that dowager's hump thing. And so I've always known about emotional anatomy, always. And how does the emotional anatomy manifest in an individual? How do those held emotions manifest? They manifest through soft tissue structures. They manifest through the fascia. And any massage therapist or yoga teacher will tell you that when people get to a certain stage, they'll often have big emotional releases, like start to cry or get really angry or whatever it is, because the truth of our lives, or as Alice Miller said, the truth of our childhood is stored in our bodies. Yeah. And it's stored in the fascia. So anyway, so I met Bob, I worked with Bob, I worked with his trainers, since have been working with other people who do the fascial patterns. There's ways, what Bob found, which is wonderful, all the yoga asanas are designed to stimulate a particular acupuncture meridian. So the small intestine stretch, small intestines are located just between the shoulder blades on the back. That's the TCM thing. So to treat your small intestine, you press your arms together this way till you feel it in the back. So you press together, feel that in your back, and then you resist as you open, and then you press down again and resist as you open, and you press down again, getting those together. And I couldn't even put my elbows together when I started. Couldn't even get them together. It hurt that much. So I basically began to rehabilitate my body and my organs through knowing which places to stretch in the fascia. And there's a stretch for every organ system. There's large intestine, there's pancreas and spleen, there's stomach meridian, sexual meridian, which is the central channel, all kinds of things. And I have been incorporating that into my life regularly. You can do it in a hotel room. You can do those stretches anywhere. You can do it. I will often just get down on the floor in an airport waiting area lounge. Who cares? And move.
I do the same thing. I do.
Oh, yeah.
In airports, I do.
Yeah, we don't care. People also, here's what I've noticed. When you do it, they'll start to copy you. It's just like, because they definitely want to also move as well.
Yeah.
So that, and then the other person whose work I began to follow is Esther Goclay, and Esther's at Stanford in that area. Husband's a math professor at Stanford. And Esther had back pain so badly that she required surgery as a young woman. She had some discs in L4, L5. And she had back surgery. They told her she should never have another baby, and then the back pain came back after the surgery, which is so common. Yes. So Esther went around and studied primal cultures, primal movement, how they sit, how they stand, the people who have to move their bodies to make a living. And there are certain ways that all primal cultures move, that every little kid starts out moving that way. Ramrod straight back, they can squat beautifully. We're born that way. And then our built environment changes how we move, but that's also changing the fascia, and it's changing the hydraulic structures of the body. So I studied with Esther, did her foundations course. And so it's the Goclay method, and works beautifully for back pain and sleeping and stretching your spine out and that kind of thing. So she's done wonderful work. Her book is 8 Weeks to a Pain-Free Back.
We put it in the resource section of Quench. And what I love about what the most dramatic thing I felt she pictured for us is that you start out with a range of over 300 movements. She actually did the tally with these young, early societies that were still in full use of their body. We end up in our culture with less than 30 different body movements. Wow. Extraordinary picture, extraordinary information. So we're linking your hydraulic capacity as a physical being. We're limiting it by the way we move. And what we want to do in this interview in part is to really help doctors understand hydration is deeply distributed and connected to the fascial system.
That's right. That's right. In fact, it sort of is the fascial system. In a way, you can't really separate what we call the interstitium from the fascia. They're all of a piece. It's this incredible web work. And, one of the questions that I asked you, I think, is, or somebody, why have we not seen this? Because you see it in the operating room. And we also know, by the way, that an enormous amount of the immune system is distributed throughout the omentum and all of the fascia between the loops of bowel. That's all rife with immune cells. So why haven't we known about it? And it's because a lot of the early anatomy, the classical anatomy, was done on cadavers where everything was dried out. And it's, and any interstitium that you might find is saturated with formaldehyde. And it's not a very fun way to learn about the body, let me tell you.
We couldn't think of any other way but cutting it open.
Yeah, that's the other thing. Yeah.
Now that we stand on that knowledge, then it's been given to us at great cost. Then how our responsibility to continuing to add as healers and physicians, go and find out the next thing, to go and find out what we've newly discovered. And I think it's why the conversation on fascia it's not a trend conversation.
No, it's not. I mean, remember the woman who came out with the melt technique?
Oh, yes, yeah.
So that's all fascia.
Right.
And my feeling on this is, I don't care where you start, because wherever you start on your fascia, it's going to affect every other area of your body. I mean, let's just talk about, everyone knows foot reflexology, right? So, or you can even buy those socks that have all the organs listed on the sole of the feet. Well, that's on the foot, every organ is identified. On the hand, it's the same. On the ear, it's the same. So when you understand this holistic system, then you have almost the key to health in your hands. I'm currently working with a man who had a football injury years ago, and then a wrestling injury, and then ran the usual 30 marathons and hundreds of road races. And after you abuse your joints in that way, it catches up with you. So I looked at his feet and I said, this foot on the right here, this is like a cast. This is a cast. Your toes don't move. This doesn't move. I wish I had the ability to show you how his feet rehabbed in about 8 months of regular work on the fascia. So one of the things Hope taught me was how to work on the fascia of my feet, because I was learning tango, and those tango shoes, those tango stilettos, my feet, the entire fascia of my feet needed to change if I were going to learn to dance that way. Now, I would never recommend high heels for any woman. But if you consider it an athletic event, you ought to be able to dance a couple hours in high heels and then take them off. It looks good and it's fun. So I had to learn how to manipulate each toe, and Hope has on her website, which is the Center for Intuitive Movement Healing, or her Facebook page, Hope Matthews, she's got a whole series of videos that she did just to rehabilitate feet, because she broke both her feet snowboarding and then had to teach people how to rehab their feet. So she taught me, and then I taught my friend Ron, and his feet are entirely different in 8 months. They're, the toes are mobile. He can spread the toes. People don't ever think about their feet. What women are taught, it's kind of, like the latest iteration of Chinese foot binding. Yes. You should get in these Louboutin shoes. And again, that's fine. That's fine. Limo shoes. You get out of the limo, you look good, but that's it. And so then you need to learn how to do your feet. So I would come back from tango practice. I'd get in the tub with Epsom salt and do these foot exercises, manipulate each toe, pull it out, and then interdigitate my fingers through my toes, like yoga toes, and then just rotate the forefoot, and then massage the entire inner arch, which is the spine. You're literally treating your entire spine. And it is the fascial system that makes that a reality, that gives, it's funny, in Chinese medicine, you see the acupuncture dolls, you see the meridians, but the anatomical pathways are all in the fascia.
I think what's so interesting about that is the recognition. If we have the capacity now with our computers to understand that how one button can reach many, many places.
That's true, yeah. Mm-hmm.
We have the conception now that when people say, oh, your whole body's in your hand, or your whole body's in your ear, or it's in the bottom of your foot, and you can just see certain generations sort of raising their eye. But if you even go to the math and you look at fractal math, like Mandelbrot's set, this is a Mandelbrot set of the rest of your body. It's a reproduction on a smaller scale of the bigger picture, and it happens all over nature. So
yes,
of course we're going to see those qualities happening in the human body. And the part about the fascia, also, I think that whether you self-manipulate or whether you have someone help you manipulate, there's a really big difference in getting a massage and having somebody rub you while you're lax, while you're relaxed, while you're not engaged, which doesn't activate the fascia. You're getting a massage, things are being moved, but that's all temporary. It is not until you become the generator from the inside of those fascial movements that the real shaping begins to happen.
That's correct. You have to engage the muscles. You have to. So let's say that you want to change the fascia in your bicep, okay? So what you have to do is you have to pull in against resistance, you see, so like that, yes, and then push out. That gets the tricep. Now, women always get these, bat wings down here, right? Nobody wants that. It is from accumulated dense fascia. But if you do this, you do the tricep this way, you're pushing this way, and then pulling. You'll literally change the fascia, and you'll change the underlying structure of the skin. The other thing that's fascinating is the entire vaginal canal is also a lot of fascia. Oh. And when you do one of those ancient jade egg practices, you are literally treating your entire body, because the vagina has the kidney is the opening, and then we get to the liver, and then the lungs, and the heart is the cervix, which is, by the way, why you do not want to have sex with someone who you might get addicted to, because when the penis touches the cervix, it goes right to a woman's heart. And so you want to be very selective about who you let in.
Which is ancient wisdom for women.
Yeah, that's right. That's right. It's not about morality. It's practical. You just, that addiction is, it's worse than crack cocaine when you're addicted to somebody who, so let's not do that.
Well, help us. How would a physician address? Say you're in the cubicle and somebody's busy. You have a patient in front of you. You're a physician. What do you say after a conversation like this? What do you take out of this conversation into a physician's conversations or a practice with their own?
Oh, that's easy. You just say, have you discussed optimal hydration with your patients? When they come in for a well visit, or when they come in for headaches, when they come in for arthritis, when they come in for blood pressure, anything, because hydration addresses all of it. Mm-hmm. And so here's what you do, like doctor's orders on a prescription. Do the following for hydration. Come back in a month. Let's talk about it. Let's see what changed. I want you to start out, and you have to do this because things tend to get better in the human body. So you need to write down everything that's not working so well, and then see what has changed. It's that simple. And I think a physician has to, like my friend Sandra, you have to experience this in your patients to begin to believe it, because it's so simple. In our culture, the average 65-year-old is on 6 prescription drugs. So what are doctors trained to do? Give another drug. Mm-hmm. Can you imagine if you just gave the hydration formula to people? Mm-hmm. And like you said, it's different for everybody. So it's not 8 glasses of water for everybody. Yeah.
It's so thrilling to hear this, because we're actually developing a 8-minute curriculum. So any physician they can literally write hydrationfoundation.org on the prescription pad, send them to us. We know you're busy. We will give them in 8 minutes an education around hydration and how to do it more holistically, more fun, more fully, involving your foods, involving little movements, to really get them juiced up so that a physician can have that resource. Literally just go there. We're going to share as much, and it's all free. It's all about, there should never be a price tag on hydration. Really.
That's wonderful. Wonderful. Yeah. Wonderful.
I know you've also written a book called The Power of Joy, and this is kind of a sneaky question here, but I want to know if you think hydration is an active agent in joy in some way.
Of course it is. It is. Frankly, if you're dehydrated, you can't really engage the molecules of joy. It's just not going to work. So joy comes from serotonin, beta endorphin, nitric oxide, and it is our natural state. Because if you watch 2-year-olds, so they're hurt or they're angry, whatever, they get over that in about a minute, maybe 30 seconds, and then they're back to bouncing around. It's our natural state until, so I think what is the data? Is a kid laughs like 300 times a day, right? An adult, which the late Ashley Montague described as nothing but disintegrated children. An adult laughs maybe, 10, 15 times a day, max. So joy is our natural state. And I think, so think about it. What do we say about people? Oh God, she's a dried up old, whatever, right? We know that. It's like the fluids, she's not juicy. There's no fluidity. There's no joy. She's dried up. So why don't we start with what happens if you get re-moisturized, if you get juicy again, right? Yeah.
Yeah, I love that, Dr. Northrup. Can you share 3 ways you hydrate? You already have. You talked about adding chia seed and salt to your water, using a special system. Is there anything we missed?
The humidifier in my bedroom and applying some kind of mist.
Yeah, they're rose hydrate. They're called hydrosols are the most fun.
That's right. That's right.
Plant agent in them. And of course, roses are the most hydrating of all the flowers. And many they were raised medicinally for the purposes of hydration and ingested internally as an original part of the Arab culture. So the widespread roses and rose use there were raised from medicine.
That's wonderful. Yeah.
So yes, a rose hydrosol is a great.
Yes. Yes. Wonderful.
Is there something you'd like to see addressed in this interview that we might have missed?
I think we've covered it. I think, but the main thing I want people to know is that what they experience as joint limitation, let me give you an example. So I was learning tango, and there's a lot of counterclockwise. There's, your hips are going that way and your chest is going that way. I mean, it's like, so you have to learn how to turn this way. Mm-hmm. And if I were a normal person, I would have said, oh, I can't do this because this hurts my back. Mm-hmm. What I knew is the only reason that this hurts in any way is that I have not done it. Mm-hmm. The fascia will follow the patterns of your thoughts, your emotions, and your movement. Mm-hmm. It's constantly changing, which means that I don't care what age you are, you can improve your structure, you can improve your fascia. It's never too late. I have just rehabbed the feet of a man who's in his 70s, and they are beautiful. And if you went, here's what we do in medicine. We think that this is all mechanical. So he was given a bunch of orthotics. That doesn't really address the problem. What it does is it makes it easier to maintain an abnormal pattern. So you must address the fascia, and then everything else follows suit.
Wow, I'm so impressed with how you hold this and think about it. I really love the idea that we're never to disintegrate. There's opportunity to be becoming more of who we are, becoming more fluid, don't buy the myth that it's just because of your age.
That's right.
Because of your circumstances. It's so exciting to think. What one part of this conversation I'd like to just bring to the fore is that the fascia, along with all the other ways we've talked about it, is also an information system.
Yes.
So when you sit down and collapse and kind of die inside, that's information going to your body.
That's right.
So we all have seasons of giving up. That's fine. It's just the struggles we'll have. But the information system in our body called the fascia, if we can give it a little direction, say, well, I'll just move a little, I'll just move my neck a little. I'll just, whatever that little moment is an information shout out to the rest of you to come on.
That's right. That's right. That's exactly right. And we all know this. When you put on your running shoes or your walking shoes and you say, I don't really want to do this. So what you say to your head, I'll just give it 5 minutes and then I'm going to come home. Yeah. And what happens is you never come home because the minute you start, there you go. Yeah. And the fascia is like that. And then over time, what happens is as you learn to stretch it and to change it and remodel it, you love the way it feels. At first, it can be a little gnarly. I will be the first to tell you. I mean, I could not get my elbows together. It literally hurt because I had so much dense accumulated fascia in the small intestine meridian. Now it feels wonderful. Same with the lung stretch and the large intestine stretch and all of it. It feels really good. And when it doesn't feel really good, I do it anyway. And then the next time I do it, it's remarkably better because the fascia responds so instantaneously to your movement patterns.
Yes. If you view it as a digital system.
That's right.
It's got the message and it's like, I'll have a little more, please.
That's right. That's right. Exactly right. Yep.
Well, I love this conversation. I'm loving your place in the world, the way you've made a map and drawn a wake behind you, people who understand things more differently and more joyfully about why we're not just disintegrating. We're actually keeping ourselves alive, and how we choose to do that is, through the power of joy, how important that is.
Right.
We thank you. The Hydration Foundation thanks you for your love and support, for your lifelong work to heal those in your sphere. You've had an impact for us, the way that you recommended Quench. You made people read it. You've got the conversation about hydration on your radio program, and we really are very committed to helping people understand that water is life. It is juiciness. It is fluidity. It's an information system, and we really want to be plugged in there. So helping other physicians find a way to hydrate their patients and colleagues is a great task.
Right. Okay.
For helping us spread our mission.
You're so welcome. Thank you so much.
Bye.
Good. Bye-bye.
So, Chris, I can turn off the recording